Welcome back to Across Louisiana. You know, for many people in our community, access to health care or lack of health insurance is a huge problem, and there's an organization now that's trying to help with that. Here to tell us all about it is Dr. Ronnie Whitfield with the National Association of Free and Charitable Clinics. Welcome to the show, Dr. Whitfield.
Thanks, Dennis. Thanks for having me.
For people who might not be familiar with this organization, tell me a little bit about what NAFC does.
The National Association of Free and Charitable Clinics is a national organization based out of Washington, D.C., but they travel around the country putting on free healthcare clinics. More than that, though, they set up the individuals that are seen at these free healthcare clinics with the what we call safety net providers in the area. So they're coming to New Orleans for the fourth time to set up what we call the largest medical clinic in the world for a day. There'll be about 60 doctors' offices. Usually we have over 1,000 volunteers and hopefully over 1,000 patients. We've seen 3,100 patients in New Orleans over the course of the 3 visits. So it's a huge healthcare clinic where we provide many services, but more importantly, it's bigger than that one day. We're able to set these patients up with continuing care once they leave the clinic.
That's really a huge impact. I mean, that's really making a mark on that problem. Yeah. Talk to me a little bit about that. I mean, in the wake of Affordable Care Act and all that, I think a lot of people don't realize that there's still lots of folks out there who might not have access to health care or to health insurance. So talk to me a little bit about that.
Yeah, that's a big issue. In Louisiana, 1 out of 4 Louisiana adults is uninsured, but many of them are working. And so even once the Affordable Care Act is implemented, the working poor, about 29 million people in this country will not be covered by insurance. So again, this clinic is huge to me because it's going to set up patients with freestanding clinics that will see you whether you can have access to income health care or not. So this is a big deal. So again, you got 29 million people that won't have coverage even once the Affordable Care Act is implemented in 2014. So this is a great thing, but we need more volunteers and obviously more donations to keep these clinics ongoing.
I mean, this sounds like a great vehicle to provide the underserved with care, obviously, but you mentioned the need for volunteers. If I'm somebody out in the community, you know, that wants to take part in this worthwhile program or you know, get more information on that, what do I need to do?
Well, we have a website, nafcclinics.org. You can go on the site and register. We're still taking registrants. They pay for your meals while you're there. You get a T-shirt, free parking, but it's a long, tough day. You're quite tired. I'm there usually from 4 in the morning until about 11 o'clock that night. The clinic's actually only from 10 to 5, but you know, of course, with that many patients, it takes a while to get everybody seen. But it's a great day, and it's probably one of the best things that I think I've ever done in medicine. It's truly helping people without the pressures from the insurance companies. You know, I'm a doctor for a day, just addressing health issues, and it's not just for sick people. There are people that come for sports physicals, for job physicals, or they just haven't seen a doctor in a while, so just some basic primary care services. And we're testing for HIV and doing HIV counseling, screening for referring for mammogram screening, cholesterol, blood pressure, diabetes screening, as well as mental health services as well.
Talk to me a little bit more about that. I mean, for you personally, what's been the impact of working on this for you? I mean, I know you see patients every day, but this has got to be kind of a little bit special or a little bit different than your usual.
It's different. Yeah. It's rewarding, though. The individuals in New Orleans, and we've had patients come from different cities and different states to be seen in the New Orleans clinic because they've seen us on national media outlets. But it's probably the most rewarding thing that I've done to help somebody and for them to say thank you. I think many times in private practice, patients come in and not feeling well, they're just there to get better. In this particular setting, people are very, very appreciative of the volunteer services that are given to them. Nobody gets paid, you know, we're just there because you want to be there. So you see some folks really working, nurses, nurse practitioners, laymen, just individuals from the community who want to come and give back and really help the community. So it's a great thing, and it's really something that comes from the heart.
And, I mean, it sounds like it's really a total team effort as well.
It's got to be a team. They run a well-oiled machine there. We have a central services supply area where all the medical equipment are located. Then there's outline patient information, education. So just a lot of stuff going on. It's a great, well-run medical clinic for a day.
Real quick, tell the folks where they can find out more.
nafcclinics.org is the website. Go on there and you can register and find out more information about the National Association of Free and Charitable Clinics.
Fantastic, Dr. Whitfield. Thanks for coming on and giving us a scoop on that. Good luck with that.
Definitely.